Okay, good evening. This is David again. So in the last video, I talked about kind of the initial diagnosis. Now I want to talk about what happened after the initial diagnosis of melanoma. So there were a couple of things that happened. One is I had to get a surgery done. Essentially what they do is they are going to cut more skin and more tissue out around the mole just to make sure that they got it all, that they didn't leave any cancer cells in that area. At the same time they do that, they'll also do a lymph node biopsy. So what they want to go in and do is find the one or two lymph nodes that are nearest to that area that the cancer would most likely travel to, and then biopsy those. So in order to do that, they inject you with a radioactive material that would trace the path of cancer, and it will essentially light up one or two lymph nodes, and then they'll go in and take those out. And so that's what happened with me. They did the removal of the skin and tissue. They also removed, in my case, one lymph node and did a biopsy on it. In my case, it turned out that that biopsy came back positive for cancer. And the amount of cancer in that lymph node was very small, though. It was less than 1 millimeter. Less than 2 millimeters is considered micro. So what they said, I had micro metastatic melanoma. If it's larger than 2, then it's obviously more advanced spread. Or if it's in multiple nodes, it's obviously more advanced spread. At this point, all I knew was that it was in one node, that it was micrometastatic melanoma. The other things that they do then, besides the surgery, is they're going to try to continue to type it, and therefore they need to do some scans. So one common scan is a PET scan, which very easy. You essentially get put into a machine that will try to detect cancer. The way they do that is they put a glucose sugar into your veins and your arteries and pumps through your body, and then I guess that glucose sugar attaches better to cancer cells than normal cells, and so they look for aggregation of this glucose. So if they're essentially looking for cancer in any organs, liver, lungs, or really anything, they scan your whole body. In my case, that was negative, so there was no obvious sign of cancer in other areas. Now, an important thing to note here is that the amount of cancer I had in my lymph node, less than 1 millimeter, if that same amount of cancer existed in my liver or my lungs, the PET scan would not even pick it up. It would be too small for the PET scan to pick it up. So the PET scan is not an absolute answer that there is no other cancer in your internal organs, but it is certainly a good indicator if the cancer is not large enough that it can be detected by a PET scan. In addition to the PET scan, I also had a brain MRI done to check for cancer in the brain. In my case, again, that was negative also. So at this point, I was staged at 3A. 3 because it was in the lymph nodes, A because it was such a small amount in the lymph nodes, and I was not in stage 4 because there was no detection in the other organs and so forth. After this, I guess I want to talk about the lymph node dissection, which would be the next kind of stage in this process. There's really a couple of treatments that would be recommended at this point. I'll go into both of those in the next video.